The first thing I'd like to do as I welcome you to the Policy Pitchfest is to just acknowledge that everywhere in Colorado, we are on occupied land, the land of the Ute, the Arapaho, the Cheyenne, and 48 plus other nations that still live and work and travel through, and our neighbors on this land. So that's a recognition that I always like to make. I'd also like to welcome our celebrity judges. We have with us today Senator Daphna Michaelson-Jenet, who I had the great pleasure of attending many years ago, Emerge candidate training, and look how far she's come. Pretty awesome. We also have Representative Judy Amabile with us here today. She is actually a co-founder of Good Business Colorado, who had a manufacturing business of Polar water bottles and now is in the legislature. We also have Representative Shannon Bird is with us today. Thank you so much for being here. And Representative Lorena Garcia is also here with us today, and I'm so pleased to have them with us, taking the time to judge our Policy Pitch Fest. Let's see, anything else I've got to say real quick? Right, I wanted to introduce Teresa from Rocky Mountain Microfinance Institute, who sponsored this event. She's our sponsor for this event, and we are so grateful for that. Teresa, did you want to say a couple words?
Yeah, I'd love to. Thanks, Angelique. I won't keep us too long. I just wanted to say thank you and welcome all the entrepreneurs in the room, all the senators, all the representatives. My name is Teresa Rainey-Myers, and I'm with Rocky Mountain Microfinance Institute. We are an organization that creates the space for people and communities of all backgrounds to realize their unique potential through the power of entrepreneurship. We offer mission-based business loans, business grants, educational cohorts, workshops, mentorship, and community building for entrepreneurs and micro businesses who have barriers to accessing these resources. We've helped launch and start more than 500 businesses in Colorado. When we worked with Good Business Colorado for a long time, when they shared their vision for this portion of the Level Up Academy to include this Policy Pitch Fest led and supported by entrepreneurs, I knew that we were in. Because we, like Good Business Colorado, recognize that entrepreneurs are not only business leaders, but are community leaders. And so our work at RMMFI to activate and to mobilize community often overlaps with policy. So last year, we rallied our network to help advance the removal of medical debt on credit reports that passed last legislative cycle. We've been active participants in the Clean Slate legislation and implementation that removed barriers for formerly incarcerated individuals. Along with Angelique, we've written letters and op-eds, particularly during the pandemic, to help advocate for more equitable distribution of COVID relief funds to small businesses. And we serve, and many of our entrepreneurs serve on Good Business Colorado's policy committee. All with the hope that policy can remove barriers and create opportunities for entrepreneurs. So I am so thrilled to be able to be here to sponsor and to partner on the Policy Pitch Fest to bring more inclusive small business legislation to Colorado. Excited to listen and learn, and thank you to everyone, especially Good Business Colorado. Y'all are awesome.
Thank you so much. Okay, real quick, how this is going to go. We have 4 awesome teams. They're each going to show their slides, do a 10-minute pitch, and then our judges will have 10 minutes to provide some feedback to each of the groups. And then hopefully at the end, we'll have a little bit of time for the judges to confer in another room. And if they are able to come to it, they will give us their 1 or 2 that they think are ready to rock and roll. And then our finalists will get a vote of our whole membership over the next couple of weeks to decide what will be our signature legislation. I've heard all the practice pitches. They are such great ideas. Judges, you're going to have a hard time. And without further ado, I'm going to introduce the first team. So I'm going to just throw it to Cynthia and let you introduce your team and start your slides.
Awesome. Thank you all for being here and to listen to our pitch for our local food and local restaurants incentive. Just a real quick, I want to share a short story that led to the inception of the bill we're proposing to you today. My husband and I opened a food cart on the property of my family's ranch in 2010 so we could serve the delicious grass-fed beef and dairy as well as our own organic vegetables produced on our ranch to the public. We grew quickly and continued this model by supporting other organic farmers and ranchers, and the demand grew to the point where we needed to build a real building that housed the restaurant and a market which supports small-scale local agriculture. During these past 14 years, we have seen that it is financially feasible to commit to serving our guests as many local nutrient-dense ingredients as we could source. And once I researched that the average household spends 49% of their food budget at restaurants, I realized that if other restaurant owners source locally and even a small percentage of what I do, the ripple effect could be incredibly impactful. And knowing the price difference between local and industrial ingredients can be 3 times more. It seemed offering a tax credit was the only way to get other restaurants to consider making this shift in purchasing habits and start building relationships with their local farmers and ranchers. The current purchasing pattern for restaurants.
Cynthia, can I just make sure that you have slides up if you want them?
Oh, are they not up?
They're not up.
Oh, so sorry. Hold on.
They're up on ours.
It's okay. You're doing great. I love the story.
All right.
So finish off right here.
So I was just sharing that the current purchasing pattern for restaurants right now, except for ours, is to buy industrial, subsidized, easily accessible food that in the end is feeding their customers cheap, empty, toxic, industrial food that lacks flavor and nutrition. And the hard truth about that is since industrial processed food is less expensive and more easily accessible to restaurants, most food supplied to restaurants comes from this type of production and is genetically altered, chemically treated, has diminished nutrient density due to being grown in dead soil. For example, you have to eat 6 potatoes grown in dead soil, industrial produced, to equal the nutrient density of 1 potato grown in healthy soil. And I hope you like kale, because if you have to eat 5 servings of industrial kale to get the nutrient density of 1 serving grown in healthy soil. And we also know that grass-fed meat and dairy are higher in antioxidants, beta-carotene, and vitamin D that grain-fed feedlot cattle are not. So, Jarrod.
Yes. Hello, everybody. The results from having dead soil and eating industrial produced food is causing citizens to eat food which is proven to result in obesity and other chronic diseases, creating an unhealthy, obese, disease-ridden country. People in our country are suffering. 42.4% of adults and 25.4% of children have obesity. 12.9% of consumer private payer spending is based on obesity. One of the major ripple effects from eating nutrient lacking and toxic food is the fact that we have seen an inflation adjusted 662% increase in national healthcare spending over the past 50 years. This is not even mentioning the ever increasing mental and emotional health struggles of not only our citizens, but also our farmers and ranchers. According to the National Rural Health Association, the rate of suicide among farmers is 3.5 times higher than the general population.
So the physical and mental health crises are only part of the tragedy when we look at industrial food and agriculture, because the ripple effect is far-reaching and severe. It is one of the biggest ways in which we've disconnected from nature and thus are suffering the results. To further illustrate our current predicament, industrial agriculture is one of the biggest contributors to the extreme imbalance of our planet's health and systems. Due to this destructive treatment of the land and thus the lack of soil health, we have consequently also broken the planet's natural return route for carbon being sequestered in the soil via photosynthesis and a healthy soil microbiome. This combination of fossil fuel use and industrial ag has created a legacy load of carbon dioxide in our atmosphere, and the oceans are taking the brunt of it, which is contributing to the increasing acidification and warming of our oceans. This all creates a lack of balance in all of our Earth's systems, as everything is connected, which leads to ever-increasing and extreme vulnerability to drought, floods, wildfires, erosion, and extreme storms. Billion-dollar disasters are increasing in frequency across the U.S. Just as an example, Colorado's increased wildfire activity from drought in just the last 20 years, and 4 of the top 5 largest have occurred in between 2018 and 2020. When we look at drought, and as we can see from these stats on the screen, we're seeing worsening drought. And meanwhile, in the 23-24 budget for Colorado, we decreased funding for soil health, small food business grants, community access food programs, and the agricultural workforce, which is going in the opposite direction of what we need. These vicious cycles will continue if we don't do something different. And as Albert Einstein said, we cannot solve our problems with the same thinking we used when we created them.
One solution to reversing these vicious cycles is to incentivize restaurants with a 20% tax credit to purchase local, nutrient-dense, non-toxic, regenerative food. Since we all know that the average household spends 49% of their food budget at restaurants, having more restaurants offering ingredients like these would have a positive ripple effect, creating a cascade of good, including massively supporting Colorado's small-scale hardworking farmers and ranchers who care for the soil, and creating the ability and demand for more farmers and ranchers to do the same. Nature's health is our health. For every 1% of positive soil organic matter added to an acre of land, that acre can hold an extra 20,000 gallons of water. There are farmers and ranchers out there right now adding 7% additional soil organic matter to their land through regenerative management, like Rocky Farms in the San Luis Valley, where many farmers struggle for water rights. Approximately 57.6 billion tons of topsoil has been lost in the U.S. in the last 160 years, mostly off of poorly managed agriculture land. Here's a great example of regenerative versus desertification. On the left is Boulder County. This is in Boulder County, and this is a Boulder County open space. It's desertified, and the wind has taken the land down to the subsoil due to the lack of beneficial animal impact. Now, sharing a fence line on the right is a regenerative farm. This land is healthy with good soil organic matter due to regenerative land management, including keeping the roots in the ground and utilizing beneficial animal impact.
So the creation of truly regenerative and healthy cycles is possible because when we heal the land, we heal ourselves. Understandably, all of the concerning personal and planetary health issues that we are currently facing can be extremely overwhelming. However, because of nature's natural state being constantly regenerating, these concerns can be drastically reduced if large purchasers like restaurants increasingly support local and regenerative. This in turn also supports our farmers and ranchers' financial, physical, and mental and emotional health, along with their families too. All of this creates a foundation of health and vitality in both Colorado's rural and urban communities.
I think we can all agree that our citizens need healthier soil to generate healthier food. The National Heart, Lung, and Blood Institute found that increased intake of foods with high nutrient density can help to break the intergenerational cycle of malnutrition and obesity. And according to the New York Times, large population studies have found that people who eat a lot of nutrient-dense foods report less depression and greater levels of happiness and mental well-being. Now, how does this potentially tie into lowering the state healthcare costs? Well, thanks to studies that have linked to higher intakes of nutrients with lower health risks, we were able to calculate a low percentage assumption on what the state would save from fostering a healthier population. If we decreased only by 1% of non-communicable diseases and only 1% of depression in the state of Colorado from incentivizing nutrient-dense food in restaurants, we would save the state approximately $28 million a year.
So the holistic impact. This small incentive is a drop in Colorado's budget bucket and could start a positive ripple effect for our whole community, as well as strengthening current bills and initiatives such as STAR, Zero Foodprint, and community food access programs. Here's an example of the potential financial impact that this tax credit could have on Colorado based on an average restaurant's gross income of $1.3 million a year. The average food cost for a restaurant grossing that income is about $390,000. If they were to only have 10% of their ingredients sourced locally, that would equal $39,000. Now multiply that times the 20% tax credit, and they would receive $7,800 for the year. Currently, there are approximately 12,900 restaurants in Colorado. So for now, if only 10% were to commit to sourcing this way, that would lead us to 1,290 restaurants participating. If we multiply that times each participating restaurant, that would just be around a $10 million year in tax credits given to restaurants. Now, in Colorado, in 2022, Colorado restaurants brought in $426 million in state sales tax revenue. This does not include local tax or the taxes generated from the 11% of the population that restaurants currently employ. At the end of the day, this tax credit would only equal 2% of what was collected for the state sales tax revenue.
And we understand that there will be a need to support restaurants in order to make this successful. Besides just an amazing 20% tax credit, we're looking at support through like an online marketplace, relationship building assistance between restaurants and farmers and ranchers, marketing tools for like website and social media, education for staff and customers, and other necessary onboarding processes. There is potential for opposition from big ag, big food, large food distributors, and big pharma. We welcome their involvement in this much needed transition. And we are excited that this incentive is the first of its kind, and it situates Colorado as a standout leader in the local regenerative movement. We already have seen great traction with local regenerative food hubs popping up all over Colorado, a community food access program bill that recently passed. 2 new bills are in the works for regenerative ag and beginning farmers, and there's proven consumer awareness and desire for food grown and raised this way. The timing really couldn't be better, as people and the planet cannot wait any longer for robust and impactful proactive health solutions.
We want to point out that we have supporting partners already. Right now, Senator Cleve Simpson is pending as one of our sponsors. The coalition that we're developing is with the Colorado Department of Agriculture STAR program, East Denver Food Hub, Lance Wheeler from Rafter W Ranch, Katrina Blair, Turtle Lake Refuge, stakeholders like Sarah Gleason with the Savory Institute, who's the EOV project director, and then a rancher owner at Gleason Bison, as well as all of my family members, Joe Wheeling, Dan James, Julie James Ott at the James Ranch. We also want to just thank everybody that's on this team that brought this to you, which that's me, the owner of the James Ranch Grill. We have Mandy Magill, who's our regenerative agriculture educator and consultant, both of us based in Durango, and then Jarrod Ferstl, who's an employee benefits broker up in Boulder, Colorado, and our mentor, Allie Michaelson, who couldn't be here today, who's the state legislator director at the ASPC. Yay. And we just want to thank you for your time and allowing us to share this bill with you today. Thank you.
Thank you so much. I know we had a little technical difficulty, so I gave you a couple extra minutes, and we will give our legislators an opportunity to weigh in. What do you think? Maybe we can start with Senator Michaelson-Jenet.
Great presentation. Sorry about the technical difficulties. It happens to all of us. We tend to have challenges with tax credits. There are a lot of tax credits in Colorado. So my friend Shannon Bird can speak to that much better. But it's just something to be aware of, that it's a possible barrier to what you want to do. That being said, I appreciate what you have said it will do, and especially to our mental and physical health, which I couldn't agree more. So thank you. Good job.
Thank you.
Thank you.
Great. Representative Amabile?
Yeah, I'm going to go next so that Shannon Bird can weigh in on all the tax stuff at the end, because she's the one who knows the most about that, I would guess, on this call. So I have been all summer hearing and visiting places that do regenerative agriculture, and there's so many benefits to it, and all the things you talked about, and all the water issues, all the chemical issues, all of that stuff. And I think everybody has a slightly different definition of what it is. But I definitely think we want to do things that encourage us to do more of it. And so it sounds like a great idea.
Thank you.
And I like the tax funding mechanism because it doesn't necessarily take money directly out of the general fund or out of the legislative set aside. So I think it's a good way to do it. But I'm not in the weeds on that.
Let's go with Rep. Bird.
So I loved your presentation. I thought it was a lot of fun. A lot of really good information. If I were you, I would state, though, at the beginning of your presentation what your solution is, what it is that you're looking for, which is the tax credit, because I was kind of following through, and maybe my comments right now aren't so much on the legislative piece, but as you're pitching things, I kind of want to know what your solution is, because I was thinking, the solution must be get rid of industrial farming, which I think it kind of is, but the legislative solution isn't that, right? Yeah. So if I were you, I'd be much more precise and clear about what it is you're offering. Tax credits, I think, are a helpful tool that we use in state government. There's something that we are warm to in years when we have a Tabor surplus. And I hope many of you on the call know what that means. But in years when we are taking in more tax revenue than the state is legally allowed to keep, those are good times for us to use tax incentives as a way to achieve important policy goals. So what I would advise you there, I think the timing is good. We've got a few years of over $1 billion in Tabor excess dollars coming up. So this is a good time for you to offer solutions that contemplate a tax credit. That being said, here are some things to take note of. What I would do if I were you, set in a limit, a time period for which you would propose for this tax credit to last. So pick a time. Start off with maybe 5 years, after which the tax credit would sunset and could be reevaluated for its efficacy. What you also want to do is say, what are we trying to achieve here? How do we know whether we've achieved our objective with this tax credit? What's something measurable that we can look at? What's the deliverable? You're business people. You will think of a way to do this. So identify what constitutes success in your mind, right? And that should be in part of your legislation. What are we going to measure that shows whether we got a return for our legislative effort? And really, it's foregone revenue to the state. So was foregoing this revenue worth it? Also, how you would want to set an upper limit for how much we'd want to pay out on the tax credit, because we don't want to go into this unknowing would be the maximum amount. So how much do you want to dedicate to that? So be precise there. Perfect. And I think that's it. If I think of anything else, I'll let you know. But these are usually the things that I look for as a member of appropriations and finance for many years that we look for on these tax credits. But really good job. Very exciting.
Thank you. Thank you so much.
Thank
you. And Rep Garcia, what do you think?
Yeah, I really appreciated your presentation. I loved that you did focus more of your presentation on the general impact of what regenerative soil farming, get the words, it does. I think what I would think about as you are presenting this, I would have liked to see a little bit more details on your number slide. You went through that really fast. And what would have been helpful for me there is to have a greater picture similar to what Rep. Bird. Hey, Brian, put yourself on mute, homie. Thanks. So I would love to have seen a little bit more like we were talking about, even if it's just 10%, it's $35,000. But I want to see how do you anticipate that savings to be a return on Colorado's economy? And so that's something that I would have liked to hear more about. But otherwise, I thought it was great. I love the idea. I totally support tax credits for good things.
Great. Thank you. All right. We're going to move right along to our next presenter.
I'm Stacy Gilbert. I'm with Denver Tech Insurance. I've been in the field of employee benefits over 25 years to the Fortune 200 level. And I've been in this industry all the way before we even had PPOs and HMOs. So I'm coming from this at a very unique perspective. And I know that most of the brokers that you guys encounter as representatives are far-right Republicans that don't want to talk about this kind of stuff. They support the insurance industry. So I'm going to use my 10 minutes to talk about lowering costs with a mandatory reference-based pricing range on all ACA fully insured, level-funded, and self-funded health plans headquartered in the state of Colorado, instead of PPO and HMO networks. So the cost of healthcare just keeps rising and rising on fully insured, level funded, and self-funded plans. It's not going to stop. Inflation's affecting it. All the different things that they have to buy for hospitals and all the new ones that are opening up. It's just going to keep going up. But the problem starts with the multiple PPO and HMO networks in Colorado and nationwide. Currently, these PPOs and HMOs have contracts with hospitals and medical providers with pricing that's opaque to customers. Medical providers join the network. They sign a contract knowing they're going to be paid based on the contracted reimbursement rate and their cost for that PPO and HMO network. You've got creating the provider network, deciding which facilities are contracted, recruiting and marketing of the network to the medical providers, contracts, website directory, upkeep of new and terminating providers, and electronic networks, records inside the network. PPO and HMO networks have only been around since 1990s. Prior to that, insureds were paid their provider based on reasonable and customary in the insurance contract to utilize any provider they wanted to see. PPO and HMO networks have become a marketing program for hospitals. Networks help tie the patient to their hospitals and doctors and provide patients to new medical providers. PPO and HMO network costs are built into your health plan at around 14 to 20% of the premiums you pay to maintain these HMO and PPO networks. Many HMO networks are getting skinnier, providing less care and less access to providers that insureds need. These networks and hospital insurance plans are starting to become discriminatory. Some of the problems we have with these networks are that the directories are not up to date. You go on to the insurance company's website and it says, sorry, no new patients. If you're a current patient, they'll take you, but not if you've never been their patient. There's problems with the lack of primary care physicians in some areas, the Front Range and rural areas. Front desk personnel in medical offices don't have the bandwidth to track all these PPO and HMO networks with the same insurance company. Look at the bottom, this list I have here. This is just a couple of networks, and there's dozens of networks all over the country and even in the state of Colorado. That's what a front desk staff has to deal with when it comes to the two big ACA and self-funded insurance companies on the ID cards. And then we've got the problem of referral to specialist issues. Providers don't have the time to set up a referral for a patient or an electronic referral not sent quick enough. Patients get stuck with bills because they're not able to get their PCP to get the referral to go through. The HMO network doesn't have the insurance providers. This is a problem with the fact that we've got United and Anthem with competing networks that really have very little overlap. And discriminatory to patients that need care at medical providers who handle some of the most unusual health cases, and that provider who will provide the best outcome is not on their network. And typically, people that have the sickest of the sick issues, they're going to go to UC Health. There are places in different parts of our Front Range where we've got providers that specialize in certain things that somebody might want to go to, but UC Health isn't on everybody's network. And do you really think the medical director of the HMO is going to approve out of network care? Rarely. Do they care if you die because the provider you need is UC Health or Mayo Clinic? Questionable. So we're going to talk about change. What can we do to get rid of these networks and go back to where we were before? And if we can get rid of PPO and HMO networks, what we'd be using is reference-based pricing. And reference-based pricing is a reimbursement method that uses Medicare rates or derived equivalent as a reference and prices reimbursement of medical claims based on a multiple of Medicare. 100% of Medicare is what's paid for Medicare and patients. RBP plans use their reference point as the Medicare reimbursement place rate plus amount on top of that. And we do have information out there, which I'm going to go into in some slides here in a minute, that shows that reference-based pricing on Medicare is basically there for hospitals. And they have cash-based pricing. So this is an example of an average hospital price in Colorado by region based on the reference to Medicare. This is what is built into your premium. So if you're in Denver, you're looking at almost 300% of Medicare is built into your premiums. And if you live up in Fort Collins, 384% of Medicare is already built into your premiums. And this is not quite accurate because if you get out into the ski areas, some of those people are seeing 600 to 900% of Medicare built into their premiums. And that's why the braid areas are so high up there. This is just a cross section of some of the hospitals around the state of Colorado, just showing the discrepancies in price. And you can see the higher prices on the right and on the left. Mostly rural areas had some lower prices. We're not talking ski areas. And then we have a couple of big hospitals that are included in that. Denver Health tends to have lower prices. And I'm taking away from my time here. And then I wanted you guys to all see, this is where Colorado ranges compared to other states. This is an old slide. So figure it's gone up at least 30%. We're around the 300 range in Colorado. Indiana's higher than us. Ohio, New Hampshire, and Michigan are lower. But let's discuss high-cost hospitals as it relates to healthcare insurance. RBP plans in other states using reference-based pricing on level-funded and self-funded plans typically add 130 to 170% markup to the Medicare reimbursement rate, which is still far less than the 250% of Medicare many hospitals bill employer plans in the front range. Civic analysis found that Colorado hospitals are paid an average of 3 times the Medicare rate for insured inpatient and outpatient services combined. And for just outpatient services, they're paid over 3 times the Medicare rate. And I mentioned what we're seeing in the ranges earlier. Now that you've absorbed this shock, let's talk about price savings. So this is based on what I've seen trying to attempt to put a level funded plan in that had a reference-based price in it. On a PPO, you'd probably be looking at 18 to 20% less than a PPO network. And there's no network limitations. You can go anywhere in the country and the plan would pay. All providers are in network, basically. Better transparency, no network access fees, better cost predictability. On the HMO market and individual small group HMO, probably a little bit less savings because they've already started to sharpen their pencils a little bit because they're an HMO. So what are our obstacles to reference-based pricing? Well, most medical providers and hospitals in Colorado are completely unfriendly to reference-based pricing. If you don't belong to a PPO and HMO network that they belong to, they don't even want to take your ID card. And many providers are not following the law, refuse to provide their cash pricing on their website, and insist on filing insurance when you want to pay cash, which can be less than an office visit for something where you're having something done in the office. The Colorado option pricing, there's not enough reimbursement to get agreement from all hospitals in the state to make it work as a base reimbursement to use for all Colorado plans. It means we're going to have to negotiate a little bit higher. On our BBP contract that's regulated will need to be 190 to 220%, maybe a little bit more of Medicare if it's on every Colorado health plan and every hospital and doctor in the state. Plus, you're going to need a rate area adjustment for hospitals in the mountains and plains just to get universal acceptance and keep the rural hospitals going. Only the skinniest of networks are currently part of the Colorado option plan, so we can't really call this apples to apples. We're basically looking at apples and oranges if you compare the Colorado option plan. The other obstacles we have, there's a shortage of doctors and nurses. This idea can create recruitment issues because they're going to go elsewhere where they're paid most if they have to reduce costs internally in these hospitals. So that's an issue that they're going to probably bring up and pound the table with. But you're going to see the hospital association and the large insurance companies that market themselves as Colorado Doctors Plan and Pathway, HMO and stuff. They're making money by using this setup. They don't want to lose it. This is what we're going to need to do if we put something in place and put a bill in place. There needs to be transparency listed on all hospital and medical provider websites in office and updated quarterly. Insured patients and cash pay pricing lists need to be available. And it's not just the insured and cash pay. We have a problem with alternative medicine in the state of Colorado, and I'm a user. And I see what's going on. None of these people have any kind of price transparency on their websites. They want to see you first and give you an estimate, and everybody's pricing is all over the places, whether it's chiropractic, acupuncture, PRP, prolotherapy, hormone treatment. And we have a problem with dentists and oral surgeons wanting to not take insurance in certain parts of the state. Even in South Denver, I've had that happen to me. So I want to see this all listed. Physician reimbursement, we're probably going to need to be at 135 to 160% of Medicare allowable with a cash discount. Hospital and outpatient surgery centers at 190 to 210% of Medicare. X-ray and lab, that'll have to be determined. Dialysis on these plans that are being run as level funded and self-funded RBP plans across the country, where they do take it, are at 100% of Medicare for dialysis. And I want to see all.
Stacey, we're going to have to move on. Can you skip to the good part?
Wrapped up. So these are just some of the things we want to get done. Reference-based pricing, it's already here. We have TPAs and with stop loss insurance, pharmacy manager, medical case management doing this in the enterprise market. They're getting costs cut 30 to 40% because they don't have to deal with the ACA, and they have their own ways of getting pharmacy down. State of Montana saved $13.6 million with a direct contract at 234% of Medicare. North Carolina had savings, and we have Oregon has passed legislation. Let's legislate acceptance of RBP pricing in lieu of PPO and HMO networks so business and consumers can save on healthcare. This is just one of the many ways that we can start getting costs down so that we can help consumers and help small business. And thank you.
Thank you, Stacey. We're going to have to make up a little time. So if our judges can keep it real brief and we can get back on track for the next group, that would be awesome. We're going to go in reverse order. So let's start with Rep. Garcia.
Stacey, thanks so much for that presentation, that very thorough presentation. I would have liked to see a little bit more. So I think I will ask if we're allowed to have those slides so I can
send those to you.
That'd be great. Thank you. Yeah. I mean, I think I would have been able to capture a little bit more, not somebody who's in insurance. It was a little bit hard for me to follow, but because I spent one legislative session on health and insurance, I learned a lot in those 4 months. So I was able to follow, but I think just in situations like this, where not all of us have the expertise that you have, being able to explain the information in a way that would make sense to those of us that aren't on health and insurance who deal with insurance every day, I think would have.
Well, I appreciate that. I tried to do what I could with trying to keep it as simple as possible because it's basically we used to not have PPOs and HMOs, and we don't need them. That's it in a nutshell. I mean, we're paying for these network fees that are in the contract.
All right. Any other judges want to weigh in? Shannon, yes, Rep. Bird.
Sure. So I thank you for the presentation, Stacey. I'm just going to say, I think I actually did work in a patient finance department a long time ago for Porter Hospital. And I still don't know what reference-based pricing is. I don't think, and forgive me if you had a slide that defined it and explained how it would work. But I come away from the presentation not really knowing what you were asking us to change to. So that's something you need to say what it is and how it would work. Also, this is just advice for anybody advocating for disruption or policy change from something. I think because it seems like you want to disrupt and move to make a change. I do know that HMOs and PPOs exist for a reason, that there were some benefits associated with that. I think to really strengthen your argument and your pitch, you would need to state what those reasons are, like why do we have them? What is the benefit to be sought? And then you say, and here is why this idea is better, because we can achieve these things and perhaps at a lower cost or whatever the argument is. So to make sure if you're trying to persuade legislators to make a change, you need to show how you recognize what the system that we have, recognize that there were some benefits to it, but then this is why this is better and necessitates a change. That's all I have. Thank you.
Thank you.
it was above my head in a lot of ways for me to try to figure out, is this move or is there some other move? But I go to Kaiser, and that's an HMO. And is that one of the things that you're proposing that we get rid of? Because I've been a patient there for, I think 35 years and have found it to be pretty good.
So there's different kinds of HMOs and PPOs, and you have a bricks and mortar HMO instead of an independent practice association model there. And that might have to be grandfathered in there. But these doctors that are just signing contracts that are private doctors to be on a program, there's no benefit from it anymore. Half of these networks are really too small. And I understand that you support Kaiser and you like Kaiser.
Yeah.
It's possible that if we go to a reference-based price, that they would be able to do something with Kaiser to keep those clinics going if somebody wanted to be on their product, and then they could go to any hospital that they get referred out to as part of that, but that would be a PCP-based type program. I don't know how that'll work. I'm focusing on a very general range right now, just to say, look, we didn't have this before. Let's get rid of these networks. I know that money is there. It's 18 and 20% savings. And if we can get that savings into the insurance contract, these insurance companies are going to have to just find other ways to sell against each other than networks, like giving you freebies of some kind, as being part of their insurance contract. But you and I are paying for those PPO networks and all that fat in there. And the same thing with the HMO networks. So,
Right.
Yeah, and we got to do what we can to get costs down because we don't have too many choices. This is one item, the other's prescription drugs. But this is what's being done with large groups all over the country to get their costs down. Mm-hmm. So I want to get this down to the small group level.
So, Senator Michaelson-Jenet, unless you have a burning thing to say, I'm going to jump onto the other group.
So I'm going to go straight to the burning thing. There was way too much information on your slides. There was no way to comprehend what was on your slides in the time allotted. And so I would really consider having about an eighth of the information on each slide that you had. And that still might be a little bit too much, but it would be at least absorbable.
Yeah, and I understand. I had a 20-minute presentation trained to squeeze it into 10 minutes.
Yeah. All right. We're going to move on. Thank you, Stacy, for that font of knowledge. So, John, you are promoted to co-host, so you can go ahead and start showing your slides and introduce your team.
Good afternoon, senators, representatives, and Team GBC. My name is John Bachman. Together with my teammates, Katie Burford and Brian Loma, we and mentored by Danny Katz, the executive director of COPERT. We are here today to talk about garbage with y'all. Super exciting topic. But if we're ready to talk draft, let's get this thing going. I think everybody can agree in Colorado, we live in one of the most beautiful places on a pretty fine planet. Put this up here for a little humor. I'm wondering if anybody remembers this line and who said it. This will be tough because everybody's muted except for me. My audience is muted. But here's the reveal. I figured not everybody, Governor Polis can't be the only nerd in the Colorado government. I figured everybody else may have recognized that line. I got one more for you, going way back to the graduate. I know my buddy Brian remembers the next line in this, but he's muted as well. You can unmute yourself. You can be my audience, Brian. Come on, buddy.
Did we lose everybody?
No, we're here.
Oh,
Plastics.
Hey, what's the next line on my slide with the graduate?
Plastics.
There you go. Plastics. We wouldn't be where we are today without them. And of course, there are unintended consequences. These materials of the future are killing our home, and we've known about it for some time. Approximately 1,400 tons of expanded polystyrene foam, aka styrofoam, is buried in U.S. landfills daily. We think that it can take up to 1,000 years to break down, if and only if it's getting hit by sunlight, which often doesn't occur in landfills. The whole time it's breaking down, it can be putting cancer-causing substances into our water. It's not a great thing. Perhaps some of you may have seen a story out of Missouri last week. They found a cave that was just packed with microplastics that had no human contact for 30 years. So these things are pervasive. They're everywhere, and they're making their way through the environment. In Colorado, in 2021, we passed a law eliminating these materials from food service to-go packaging. Great first step. Banning them will often, over time, they will eventually stop being put into landfills. And this is clearly better than nothing. However, small businesses, particularly food service operations, will need support through the transition to source suitable replacements and to stay profitable throughout the transition. And to honor the true spirit of the law, we think we must also take steps to ensure that compostables and recyclables can be properly sorted, transported, and processed. This legislation, the ban, is going to have a huge impact, especially on Colorado's food service industry. The industry itself is huge. I have slightly different stats from Colorado Restaurant Association than we saw in the first presentation. But I've seen that there are 13,000 almost food service operations in Colorado, employing 8% of the labor force and adding $14 billion to the Colorado economy. This ban will affect nearly all of them. One part that we've missed with the ban is a little bit of communication as to the why. Environmental stewardship is not really top of mind for most restaurant operators. They typically have more urgent concerns and haven't had time to stop and think why this is important. They're often slow to embrace change. Restaurants are notoriously slow to embrace change, and they'll need support to find the best alternatives. And they'll also need coaching on pricing strategies to offset the increased cost of these climate-friendly alternatives. During COVID, in the beginning of COVID, I found myself routinely packaging to-go orders for one of the restaurants I was responsible for. And oftentimes these orders had $10 worth of packaging, and I'm just totally erasing any of the restaurant's margins. To maximize the benefit of the change, we need to get out in front of the transition with timely and actionable information so that these restaurants don't switch to something equally bad for the planet. One of the other issues is that we're fighting right now is the sense of futility around the issue. A little bit of a why bother mentality. In many areas, restaurants cannot officially divert their compostables from the landfill. Many haulers won't accept compostable straws, cups, packaging, and flatware. Businesses are left feeling disheartened when they try to do what's right and realize that their waste stream actually ends up in the landfill. It creates this why bother mentality and discourages the adoption of alternatives. I've been there in the back of a restaurant when Western sends the trash truck to pick up the compost and actually take it to the landfill. We worked really hard to separate and sort and divert that from the landfill, and it ended up there, and that was totally disheartening. We believe that the spirit of the law, as it was enacted, must certainly be to reduce pollution in the environment and water and help us towards our 2030 climate goals. We certainly applaud that. However, not all municipalities, again, have the infrastructure and guidelines in place to collect, haul, and process organic and recyclable waste streams separately from their trash. Banning these products, again, is a great first step, but it's incomplete. So the question is asked, what can we do about it? And here to talk about what we can do about it is Brian Loma. Brian, take it away.
Good afternoon, legislators. Everybody in the audience, I hope you can hear me okay. As John said, the problem is pollution, it's trash. And what do we do about it is that we have to create a package of viable solutions so that we can answer these questions in a productive way. Climate action isn't going to happen by itself. So we have to ensure that the specific instructions to both the businesses to understand why and to understand how to make these changes. We need public policy campaigns to not only make sure that the businesses know, but that the general consumer is participating in both disposing of their food waste materials properly and choosing alternatives to reduce their footprints. And we additionally need multi-staged infrastructure. There are over 49 communities that offer recycling, and I was able to find one municipal compost site in the entire state of Colorado. So we need to be able to reduce the contamination that goes into compost sites while we go through this transition. So these are the combination of why and how we need to move upon these things. The first part, next slide, that we believe is the key aspect is to fund the Colorado Department of Public Health and Environment to make sure that the training tools are there via both the website, direct communications with food inspectors. So the tools need to be there to effectively allow businesses to understand how to do it and why they should be doing it as part of their food license training. We know, go ahead with the next slide. We know that the tools are out there. The Compost Manufacturers Association has tested accurately tens of thousands of products made to be composted and to be alternatives to the single-use plastic stream. And because, again, when we're talking about trash and solving climate change, 40% of our trash and our pollution, according to the Plastics Pollution Institute, is single-use plastics. So converting to clean, organic, divertible, and acceptable products and teaching businesses how to do that is a key aspect of the kind of changes that we need to make sure we're enacting. Next slide. We have the tools. EcoCycle in Boulder has been doing this for 40 plus years, building a process to teach all of Colorado how we can protect Colorado together. The problem is, next slide, we don't utilize multi-use and bring your own programs, and we've relied upon our to-go food packagings to be disposable. That's why the polystyrene bill was launched, or they're toxic to our bodies. That's why the PFAS bills were launched previously. So promoting bring your own programs, promoting and supporting businesses that are creating multi-use and divertible packaging programs are some of the key aspects of the solutions that we need to have. And lastly, we need to, next slide, have the infrastructure. A1 Organics in Keensburg, Colorado is the #1 largest facility and operator of organic compost diversion. In 2022, they told the communities of Boulder and Denver counties that they were no longer allowed to put non-food products into the packaging or into their disposal services because of lookalike products that were not actually biodegradable and contamination aspects. Contamination is reduced most effectively at the source when a person consuming the food is disposing of their waste. We, as I said earlier, we have 49 communities in the state of Colorado that have commercial access to organic diversion services. There's one municipal diversion facility that I was able to find in the entire state of Colorado, and only 20 total companies that provide compost or organic waste diversion services to transfer from a person's house to a compost landfill. And that's the other aspect of that, is that there's not enough locations where we're commercially diverting services. So supporting the infrastructure.
Just going to jump in and say, can you all wrap up pretty quick here?
I'm done.
Katie, I think you're up.
Katie's going to tie it all together.
Yeah. Lastly, I just wanted to say that it's critical that we do this now. The ban is an alarm or a deadline, because once operators like myself switch products, they're not going to do it again and again. So we need to act now to make sure they're switching to better products. And also just wanted to quickly highlight that there is strong public support for waste reduction efforts. Denver, Fort Collins, 17 other Colorado communities have all moved independently to regulate plastic waste. So we need to capitalize on the momentum that we have right now for these efforts. That's all. Thank you.
Fabulous. Yes.
Yeah, I'm clicking through the rest of Katie's slides because we accelerated through the end of it there. So just wrapping it up, there is legislative momentum now based on things that have been passed recently. The tourism that the state is experiencing and will continue to experience means that acting on these things now, Colorado can be a leader in what the rest of the country, leading what the rest of the country should do. And our climate action goals that are, we have some deadlines coming up by 2030. Our climate action goals demand it.
Thank you so much. Yes, great job, team. And thanks, Danny, for your mentorship for this group. We're going to let's go with Rep. Amabile first.
Okay, so I love the concept, but I guess I'm not exactly sure what the specific ask is. But I do know that up here in Boulder, when we heard we couldn't compost all these things that we thought we could compost, that was a problem. And I think you're right that it's timely, because if we don't address it now, people will just get out of the habit of trying to compost things that we thought were compostable. And you'll get a lot of people kind of giving up on it. And I like the part of it that's about education and about working with the businesses when they register. I think that's all really smart and good. And I actually think maybe there's a way to, if our emphasis is on when somebody is re-registering their business, maybe there's even a way to pay for the educational programming by charging an extra $1 to register your business, or $2 or something like that.
Yes, ma'am. I think that is one of the exact and specific requests, is that we are funding the Colorado Department of Public Health and Environment to ensure that businesses are reached multilingually to understand why the changes are happening and what they should be transitioning to. But it's just one piece of the problem, because if we don't have the places to put the stuff, and we're not funding composting infrastructure, it's not going to end up in the right spot, and it'll be turned into methane gas, just like every other thing that ends up in the landfill.
How about Rep. Garcia?
I support this brainstorm 100%. I think that there's a lot of ideas that can come out of this. I think not first, but an ongoing, just as you were mentioning, Brian, and your part is, this is a multi-pronged approach of community education, policy change, local and at the state, as well as just in general culture change. I think a lot of times when we're bringing something forward that changes or, uses the dreaded M word of mandates or the dreaded R word of regulation, everyone freaks out and says absolutely not, unless it's obviously a public health concern. And I think what we haven't done as part of a culture change is also declare the climate crisis as a public health issue. And so I think when we're able to do some culture shift there and really start to say, you know what, we are going to now restrict the use of plastics and styrofoams and support whether it's a transition for restaurants or transition for those of us who go and eat and order way too much. I mean, that's a whole other thing about portion size. We can go down that road for a long time if we wanted to. But I think that there just needs to be we need to be willing to take those steps to say, yes, we need to make this change now. And sometimes we are going to have to mandate it. And sometimes we can go slowly and incentivize. And I think that that's where we can have this conversation of what's the right step.
Great. How about Senator Michaelson-Jenet?
Thank you. Good job, Brian. I love the clarity around education, PSA, and infrastructure. I was able to consume in that slide the general gist of what you want to accomplish. What I'd love to see is it far more fleshed out, and exactly what, you were clear with the CDPHE, but what do you want to see in the PSA? Where do you want to see them placed? What kind of infrastructure should we start with? And so just getting to know a little bit more about what the steps are to achieve these goals would be amazing and great work.
Awesome. And Rep Bird.
So I think I love your thinking. It's big and it's bold. I think you need to be more specific in what your ask is. So precise, because we will have to figure out whatever it is you're asking us to do, how much it costs. So every bill that gets run comes with a fiscal note, and that's an assessment of cost so that we know how to right size our budget. We can only spend the money that we've got. And do we have enough money? So details like that help us kind of put a box around this. What exactly is it that you want? So we can figure out how much it is going to cost and who pays for it. Those are all good things too. Something else I just wanted to throw out. You had a lot of different ideas, and I've been in the legislature since 2019. We've done a lot of different bills, which I think your slides recognizes, a lot of different bills that kind of touch on different aspects of this. And I would be curious about the content of what we have already done, what that work will do to address some of these concerns. And that's kind of a criticism that we get, that we're racing ahead before even bills that we've passed just since 2019 have been fully implemented. So that would be something, if I were you, you wouldn't want to run afoul of that. Make sure you've done your research and just be certain that something you're trying to achieve with a new piece of legislation isn't something that's already contemplated with something else that we've passed, but just hasn't rolled out yet. And then also, if there is something in the works, making sure we're not reinventing the wheel, that we're building off of work that's already been done. That's just good public policy, and it also makes things cheaper. That's all. Thank you. Great work.
Thank you so much.
I just was wondering if it was possible to just answer to that just in 30 seconds. The problem that we have is that we, in our research and in our real life experiences, what we're seeing is these are the gaps. The gap in contamination in the compost has caused issues because the businesses don't know what they're doing, and they're making packaging that's contaminated because they're not educated and because it's not coming out clearly to the people who are consuming that they need to be conscientious of separating compost and recycling statewide. There's not a law that requires that anywhere in our state except for Boulder and Colorado, Denver, currently. And so when we're saying like these are the specific gaps, that's what we're trying to say.
Cool. Thank you. All right. I'm going to throw it to our last team here. Go ahead when you're ready.
Hello, my name is Rosalind Redwine, and I am here to introduce myself. I'm an African-American business owner and a woman that has had my business for the last 43 years. And I want to talk about the Small Business Taxation Equity Act that's going on. In the city and county and in the state of Colorado, there's over 600,000 small businesses. And these small businesses make up the majority of the businesses that are here in our state. These small businesses are a lifeline, not only to some, but to many of the community people that are here that have the tendency that want to go to get a trade or to do something to better themselves. We are there to be able to help them and give them a lifeline so that they can help themselves to be able to help themselves, if you can understand that. But along with that, we have a problem. The city has raised the taxes, and the taxes are so high that we can't afford to continue to keep our taxes to keep them going. So along with the team that I'm with, our team is made up of small business owners. There's organizers, and also our mentor, Jonathan Springer, who is along with us, that helps us and works with us along the way with this. And we want to present to you this Small Business Taxation Act so that we can try to get some help, not only for our small businesses, but for all small businesses all over the city and county of Denver and around the state of Colorado. Again, these property taxes are increasing, and they have gone up. As I go back over the years, looking over the taxes from when I first began my business some 43 years ago, and to see how they have escalated to today, it is almost impossible for people to continue to be able to pay these taxes along with also paying their home property taxes, they all come due all at the same time. And so therefore, it is really, really tough for many of us that are in business to be able to pay both sets of those taxes at the same time. So what we're asking is just for a little bit of help, a hand up to be able to help ourselves, These property taxes are important, and we know that they're very important. And these they're important not only to the government, but also to the state. And we know that the emergencies and the schools and education, they're funded through these taxes. But along with that, they are beginning to be such a problem for the business owners. And so I want to tell you a little story about us. We are a group of small business women and men that are at risk of being displaced because of the East Colfax corridor is regularly, we often regularly meet in order to be able to work out since the post-COVID era. We meet and we are a support team that we try to lift each other up and to keep each other encouraged, because it gets very, very discouraging. And sometimes you feel like you're out there and you're all alone. During the time that this group began to form, we found out that we were not alone, that many others were going along this way with us. And so we're just asking for two things to happen. During the time of the COVID, the governor had made an executive order that they would give help for the small businesses, and it was to no avail to help us. And so now the counties and all of the government offices are still going around, that are still open. Our property taxes are still suffering because of what's going on here with the government. And so we just need a little help to be able to help us help ourselves. So we're asking that the taxes that were in this area and all of the ones that were able to even understand and to be able that wanted and were willing to share, our taxes were at least $15,000 or more for each small business. This was a problem. So I hope that you will consider us. Amen. Thank you.
Yeah, thank you. My name is Mrs. Lola Wuri. With equipment emission testing, I've been in business for about 30 years. And what we want to talk about is that the way the tax is implemented right now is that we receive our tax notice by middle of January, and we're supposed to have two options. The first option is that we pay the full amount by April 30th, or we have the second option that we pay the first installment by February 28th and the second installment by June 15th. We know that taxes are very important for school and for other government functioning. But what we are proposing is that if they can make it like a 12 installment, that monthly payment, just like they do for sales tax and for mortgage escrow. That's what we're asking for. We appreciate you can get a proposal done for us to help us.
Good afternoon. My name is Sherilyn Halliburton. I own the Word Bible Books and Music Christian bookstore on East Colfax. I'm here to talk about the timing. It's time for us to get some relief. We have been suffering and drowning and scraping and scrapping and robbing from Peter to pay Paul, and there's something has to be done because it's getting to the point to where we can't. And then with COVID coming up and, all the businesses that went under, and there's a few of us that survived. And I can say I am the last independent Christian bookstore in the state of Colorado, and that's pretty sad. So we just want to make sure that we can get some help. Thank you.
So with our idea to have a monthly property tax payment plan, we know that our idea is fully developed and has really gained a lot of interest in the spheres of community, politics, and policy. When we take a look at the community, you heard from the small business owners. This is what they want. And that's regardless of whether or not they own or rent their current commercial property. And we also know people and organizations that advocate for small businesses like Good Business Colorado and the African Chamber of Commerce are committed to supporting small businesses with this issue. We also believe this issue to be a bipartisan issue and are super excited to know that our mentor was able to secure some initial interest from Senator James Coleman that is also very committed to pushing this forward as a bipartisan issue. We've also outlined a lot of members that deeply of the state legislature that care a lot about businesses, and we hope to continuously follow up with them in order to also capture their interest and support. And then in considering our policy, we know that this is going to impact the State Department of Revenue, the Division of Property Taxation. And so we know that we all need to be working together.
Okay, I'm here to discuss that who's going to be impacted through all of this, and the small business owners will benefit greatly because they will have more time to pay their taxes, to buy inventory, to just take care of the things that need to happen every day in a small business. The tax entities that may not be very happy about it is the Colorado property tax, the school districts, and others. But we're willing to work together so that we can make something happen that's positive.
So there are 3 competitive advantages: creating equity in a free market where we are asking for a path forward in a fair timeline, preserving small businesses. We will be able to support legacy businesses and offer even more opportunities for commercial property purchases, and creating opportunities. When we have more small businesses, we have more consumers and we have more choices, and potentially even for future legislation around cap fees. Thinking about our team is really about small businesses, legislators, county treasurers, and Department of Revenue, Good Business Colorado, and Chambers of Commerce, and property tax entity and local tax district. We think that this is a great team because these are the people that will be directly impacted. So working together, and we have not currently talked to these, but we will. But working together, it makes us more impactful.
So we know that there's a long road ahead with any type of legislation. And we know in order to have a strong legislative piece, we need to build a strong legislative coalition building and media strategy. And so between now and December 1st, we really want to focus on building our coalition, which we do hope to include county treasurers and have already started initial conversations with the Boulder County Treasurer to know that our idea can be brought into fruition. And then really stakeholder engagement. And then we'll move into a media press conference in January and really move forward with witness testimony into the legislative process. With that all being said, we really wanted to say a thank you to Good Business Colorado for offering us this opportunity. A huge thank you to our mentor, Jonathan Singer, for really breaking down the legislative process for us and really beginning the initial conversations with senators, as well as the small business member team that we have here today. So thank you all so much, and we're happy to hear your views.
Thank you so much. That was wonderful. Let's start with Representative Bird.
Well, I'm all excited. I think this is a really good idea. I was just jotting down some notes, and great job. I love to see this. It makes basic sense to me. I remember a long time ago, one of my first jobs out of college was a straight commission sales job. And we would get just one paycheck at the end of the month. And meanwhile, you've got expenses all over the place, and the amount of brain damage and budgeting that was required when your expenses aren't really aligned with the timing of the inflow of your money was so hard. And here, property taxes, you do such a nice job of outlining how big they are and the impact that they have on your lives and your business. And I can only imagine what that must be like for you. So I think it's a great idea. Now, having said that, I don't know what county administration looks like, but I can't imagine that there isn't a way to solve for this to make this situation better for our small business owners. So I'm very excited. I saw my name on your slide, and I'm looking forward to that meeting. So good work.
Thank you so much, Representative Bird. And we're excited to have that public commitment right there. So we'll definitely look forward to connecting with you. And just like we mentioned, our mentor, Jonathan Singer, has already started initial conversations with Boulder County Treasurer Paul Weissman, and we have been able to identify some potential areas of what type of language we can be looking to amend in order to make the county taxation process go a lot more easier, and that way we can provide that small business relief we've been asking for.
Great. How about Rep. Amabile?
Hi, yeah, thanks. So I agree with Rep. Bird. I think this is a great idea. I think there's 2 problems. One is because of the legacy of Gallagher, we do have just ridiculously high property taxes for business in general, and that really has a bigger impact on small business. And anybody who has a triple net lease has gotten sticker shock multiple times if they've owned their business for any amount of time. And as a tenant, of course, you don't benefit from the value going up because it's not your asset. And we certainly experienced that with our business. So I think that's something we also need to look at. But as a step along the way, I think trying to get some relief, and certainly this position of, well, let's just pay it monthly. I can't imagine, I'm with Rep. Bird, I can't imagine that we couldn't figure out a way to make that work, even just through the implementation of it. So I think that's a great idea. And I think we should be brainstorming other ways that small businesses don't get crushed by these rising property taxes. I mean, I will say that maybe those are going to start to come down as commercial real estate starts to get hit more and more by the vacancies that they're experiencing. And that would be probably good news for small business owners. And I would also love to chat with you guys more about it.
Definitely. Thank you. We need a lifeline.
Great. How about Senator Michaelson-Jenet?
Thank you so much for that presentation. It was clear, it was articulate, and very much to the point. I was disappointed with Jonathan Singer being your mentor that there were no puns. I was looking forward to some puns, but I'll let that one pass this time. I echo what my colleagues said. Nice work. Good presentation.
Thank you.
And Rep. Garcia.
I have nothing else to add except a brilliant idea. Should have been happening for a long time already. It can happen. We can make it work. And I would love to do whatever I can on the House side to help support.
Wonderful.
Awesome.
Thank you.
Awesome. Okay, we are almost at 5. I'm going to ask folks to stay just for 5 minutes. I'm going to ask my judges to go ahead and pop over to that Google Meet link that I just chatted to you. And you can maybe chat there for 5 minutes. And in the meantime, we will go ahead and close out. I'll make some closing remarks. So I just, again, want to thank everyone for joining us. A huge thanks to my hardworking teams who just have done such a wonderful job. None of you are policy experts, and I think you really did a great job at articulating some things that need some attention. I want to thank, of course, our distinguished judges, and I want to thank Rocky Mountain Microfinance Institute again for sponsoring. And if Deborah wants to jump on and close out the conference day, that would be great. Okay. All right. Deborah, I'm going to throw it to you.
Well, thank you, everybody. Thank you for sticking around, especially those of you who have been on all day, going from session to session. Another huge thank you to our conference coordinator, Sydney, to our planning committee, to our sponsors and partner organizations. Sydney, what am I missing? Can you...
Nothing. We're going to be sending a wrap-up email with some information as well. So keep an eye out for that. But thank you all. I've popped into a few of the sessions and they were super engaging. You all were asking questions. The speakers did a great job of also being engaging towards the audience and keeping them included. So just a round of applause to everyone. I feel like this was a really great opportunity for community-based learning and sharing of resources, which does not happen very often. I'm a small business owner myself. Sometimes it's lonely and it feels very siloed. So it's been nice to learn from each other and continue to communicate in the community tab, and feel free to message each other, connect. Folks put their LinkedIns, their Instagrams, their websites on Whova, on their profiles. So take advantage of that and use this space as a way to really connect with the 200 plus participants that we have over the next 2 days. And that's all I got for you. I'm going to hand it back to Angelique because I know our judges are going to be coming back. Great job to all of you who did pitches for policy. I know that took a lot of hard work, time, commitment, and you all are so busy yourselves. So kudos to you all for finding the time, right? Making a way to make it happen. All right, Angelique, I'll pass it back to you.
Absolutely. So my thought is I'm hoping that our judges will be able to come back with one or two finalists that we can move along to our voting, but it might take them more than the 5 minutes. So I'm going to suggest that we have also tomorrow our in-person Policy Pitch Fest, 3 more ideas, and 4 or 5 different legislator judges, and we'll get a finalist from that group too. And then we'll be sending out to all you members an opportunity to vote on those last 2 or 3 finalists, which one should be our signature legislation. And we're hoping that you will respond right away with your vote. We'll have the slide deck and the presentation video there for you to review.